Stress physiology, the real cause, symptoms, and management of acid reflux that we misunderstood. Hi, everyone. This is Real Easy Med Terms. In this session, we will learn about stress physiology, the real cause, symptoms, and management of acid reflux that we misunderstood. Chapter 9. Reasons for the steep increase in patients with gastroesophageal reflux disease, and Chapter 10. Prevention and management of acid reflux. Chapter 9. Reasons for the steep increase in patients with acid reflux. The exact medical term for acid reflux is gastroesophageal reflux disease. It is estimated that about 20% of the population in Western societies suffers from this disease. However, considering those who self-prescribe without going to the hospital, it may be over 30%. The prevalence of gastroesophageal reflux disease around the world is rapidly increasing, and the main cause is presumed to be westernization of diet. Chicken coated in flour and deep-fried in oil, French fries, pizza topped with rich cheese, hamburgers with patties made with ground fat, cakes with whipped cream. Ice cream made with various vegetable oils and milk fat, pork belly and beef with a thick layer of fat, ramen and snacks fried in oil, etc. The variety of dishes that use a lot of acidic fat is endless. It seems that everyone is competing to eat a lot of fat. In addition, carbonated drinks such as cola, cider, carbonated water, and fruit juice are also acidic foods. On the other hand, the intake of whole grains or vegetable side dishes, that are low in fat and can supply minerals, has decreased. So there is no way to avoid acidification of body fluids. Chapter 10. Prevention and management of acid reflux. Treatment of acid reflux is simple. This is done by keeping the body fluids slightly alkaline, preventing the pH of stomach acid from lowering and allowing the two barriers in the lining of the digestive tract to remain normal. If the acidity of the gastric juice is normal and the alkaline barrier of the stomach and esophageal walls are healthy, even if you lie down immediately after eating or exercise to increase abdominal pressure, though gastroesophageal reflux occurs, reflux will not cause esophagitis. In order to keep the body fluids weakly alkaline, it is necessary to reduce the intake of acidic foods, and increase the intake of alkaline foods, while at the same time, reduce the amount of acidic substances produced in the metabolic process. Acidic foods refer to foods high in carbohydrates, proteins, and fats, foods with a sour taste, and foods containing carbonic acid. Alkaline foods are fruits that are less sweet or vegetables that do not contain a lot of starch. Types of vegetables include melon, lettuce, bok choy, carrots, bean sprouts, cucumbers, kohlrabi, eggplant, cabbage, spinach, and broccoli, etc. To reduce the production of acidic substances in the metabolic process, fatty acids should not be over-decomposed. Fatty acid breakdown increases when cells are unable to use glucose because of insulin resistance. Insulin resistance is a symptom that occurs in the early stages of type 2 diabetes, which is adult diabetes. In other words, diabetes and gastric acid reflux are closely related. For diabetes, please refer to the lessons, The Real Causes, Symptoms, and Management of Diabetes That We Misunderstood, in YouTube channel, Real Easy Med Terms. In this session, we learned that excessive consumption of acidic foods, insufficient consumption of alkaline foods, and increased fat breakdown due to insulin resistance are the main causes of gastric acid reflux. Thus, we learned that acid reflux can be prevented by reducing the intake of acidic foods, increasing the intake of alkaline foods, and managing insulin resistance to reduce fat breakdown. We will continue to learn about the specific relationship between stress and disease. We hope you will stay with us. If you have any questions, please leave them in the comments below. This is Real Easy Med Terms. Have a great day. See you again.